And joining me now to discuss this development is a medical doctor, Jason Safo-Anin. Good to have you join us, Jason. Now, you had those claims there coming from Dr. Stella Emmanuel. How do you react?
So I think it's very clear to say that as things currently stand, we do not have enough evidence to be able to turn around and say that hydroxychloroquine is an effective treatment in the treatment of COVID-19. Since this pandemic has occurred, there have been a number of trials that have occurred all across the world looking at the use of hydroxychloroquine and other medications. There has been a paper that has been released in the New England Journal of Medicine looking at the use of hydroxychloroquine as a prevention of getting the disease, and it didn't find any benefit. There has also been a study in the UK looking at the use of hydroxychloroquine in treating people who have already caught the disease, and they actually removed the drug from the trial because they found no benefit from that. So it's very clear it's very clear on the evidence that we have at the moment that hydroxychloroquine is not an effective treatment for COVID-19.
But she claims to have treated over 300 patients with hydroxychloroquine, zinc and Zitromax. So how then do we place those claims?
So when any new drug or treatment is being tested, there's normally trials that occur, and these trials normally compare the use of the medication compared to people who aren't taking the medication. And these trials normally include, hundreds, thousands, sometimes tens of thousands of people to make sure that any differences that are seen between doing nothing or using the sort of previous gold standard treatment or using this new drug are not down to chance. It is entirely possible that the 350 patients that have been treated and have fortunately recovered from COVID may have recovered without the use of azithromycin, and that is why countries around the world are creating trials to be able to make sure that they can look at this properly in a scientific way.
Well, let me ask you, why is there so much controversy surrounding the management of COVID-19?
So it's a new novel infection. We are still learning about it as we go along. And given the impact that it has on countries across the world, on people's livelihoods, on various economies, leaders of and heads of state across the world are very keen to be able to try and find a treatment to be able to stop the spread of this disease. In science, science isn't one fixed thing. Things evolve with the passage of time, and there are things that we know now that we didn't know 15, 20 years ago. And the same will be true of COVID. So whilst we're trying to learn about this virus and how best to effectively treat it, there will be differences of opinion, which will, with the passage of time, show one side or the other to be true.
So several drugs have been touted, and we know that clinical trials are ongoing in several parts of the world. For example, we've seen hydroxychloroquine being touted by President Trump. We've also seen remdesivir. We've seen dexamethasone. Do you think that this is also fueling that controversy?
I don't necessarily think that it's fueling controversy in itself. So we know that remdesivir is shown to shorten the time that somebody with severe COVID spends in hospital. And there have been trials that have looked at that, and the evidence for that is in the public domain. The team at Oxford University looked at the use of dexamethasone and found that it reduced the likelihood of somebody having really severe symptoms. And so we have two drugs which we have evidence for. We are still looking at a wide number of drugs. And I think that the issue with hydroxychloroquine is the fact that there were two very early and small studies that came in March looking at the use of hydroxychloroquine and azithromycin from a French group. Now, these studies were very small. One of them hasn't even been peer reviewed, so that's a process of other scientists looking at their work to validate it. And because it was one of the early studies, I think that's what's put hydroxychloroquine in the minds of people.
Like you rightly said, chloroquine would now be in the minds of people. President Trump first touted this drug in April. We've heard the president of Brazil, Jair Bolsonaro, also touting this same drug. For people who would want to take this as some sort of preventive measure, what would you say to that?
I would turn around and say that they shouldn't. Hydroxychloroquine has been around, since the 1940s. It is well known to be effective in the treatment of malaria and also effective in the treatment of autoimmune diseases such as lupus. We do not have enough evidence to be able to turn around and say that it's an effective treatment for COVID. We also know that hydroxychloroquine can cause side effects in relation to the heart. And in actual fact, there was a study in Brazil, a clinical trial looking at the use of hydroxychloroquine for COVID-19 that had to be stopped because participants developed severe heart conditions. So I would turn around and say to the general public, please do not take hydroxychloroquine as a preventative medication. Listen to the advice that your local and national government tell you in relation to the coronavirus. And if you develop symptoms, please follow your local guidance as to what you should do next.
Medical Dr. Jason Safo-Anin, thanks for your time.
Thank you.